Good morning, Peter Goertz. I'm a psychiatrist. Are drug users bad people? Absolutely not, in my opinion. They're just as human as anybody else. Now, they can do bad things. You may say, my boyfriend stole my money, bought drugs. That's a bad thing. They do bad things, but they're definitely not bad people. Again, they're just as human as anybody else of us. And in fact, it's often been heartwarming for me in the past when I worked on inpatient psychiatric wards, when, let's say, a fight broke out on the ward, any of the other patients regularly jumped in to help at their own risk of getting hurt. And those other patients who helped out were drug users, people with significant criminal histories. But at that moment, their humanity kicked in and they helped at their own risk of getting hurt. So that's my perspective in general. Now, of course, drug users can do bad things, can really rub us the wrong way, can, lead to people being very angry at them. So one example is I was seeing a patient in the VA emergency room many years ago with another psychiatry doctor. And he pulled his ID card, his VA ID card, out of his pocket, and in the same hand, he had a syringe that he was using to inject heroin. Now, what was potentially infuriating about that was he was getting $2,000 a month back then, many years ago, in benefits from the VA, and of course, a lot of that $2,000 was going for heroin. So he was actually 100% service connected, and he pulled out his ID card from the VA with a syringe in the same hand, when he reached in his pocket. So that can bring up some feelings, and people think, what am I paying taxes for? They're being wasted on people who use them for drugs, etc. It's not an easy issue. Another example, drug users, why they start, there can be there can be various reasons. They're often, though, desperate people and have been through a lot of trauma in their lives. Could be Vietnam combat, could be sexual abuse, physical abuse in childhood, neglect. But in general, my experience has been that people who use drugs often have been through a lot of trauma, especially people who use IV drugs. And my experience has been, especially in women who use IV drugs, they've often been sexually, physically abused in childhood. So that's a very large percentage in my experience. Another example of a drug user in a hospital was a gentleman in his 60s. He was a heroin user, chronic heroin user. And he was on the psychiatric ward, but he started coughing up blood, and he'd been on the psychiatric ward for several days, no signs of withdrawal from heroin, so he may have just used intermittently at that point. He was in his 60s, but he was transferred to the medical floor, and a day or so later, he was found dead with a syringe in his arm, and that could have well been because the surveillance on the medical floor, it was not a locked ward, so it was different from the psychiatric ward. The surveillance was not as high as on the psychiatric ward, and he was found dead, probably from a heroin overdose with a syringe in his arm. So that's another example. Another example, again, from a gentleman who had been a heroin user, but not addicted. I mean, not that regular a user, but he was very depressed, significant criminal history of murder actually, and he was very isolated socially, and he was going to be discharged. Actually, I had gone to a conference and he was discharged during that time, and he ended up then coming back after being found unresponsive, also from a heroin overdose. So he ended up coming back to the hospital I think he ended up coming to the ICU, I'm not sure. But he also ended up coming back from with a heroin overdose. And those are examples of the second one especially. He was desperately unhappy, desperately depressed, and had medical problems also. He was in his 50s. So he was at a very high risk of suicide, but also drug use. And again, often people who use drugs, especially IV drugs, are desperate people with a long history of trauma in their lives. So it's helpful to me to look at these people and realize what's in the background of what they're doing. Even if what they're doing at the moment, they can be very disruptive, rude, angry, abusive, verbally abusive. But if you remind yourself of where they're coming from, that can put things in perspective, in my opinion. Now, having said all that, once people start using drugs heavily, let's say heroin or alcohol also, everything I say goes for alcohol also. Once people start using alcohol regularly or drugs and become addicted, physically addicted and psychologically addicted, that can take on a life of its own. And in order to deal with underlying issues, in general, in my experience, abstinence, so rehab is often necessary. Now, the other aspect of that can be very difficult is treatment for substance use is voluntary unless there's some criminal issue that a judge is in the picture for, and the judge can order involuntary treatment for substance use. So the only time, unfortunately sometimes, the only time that treatment for substance use can be forced on a person is if a judge is involved. Now, of course, there's a good side. We want people to be as free as possible, but sometimes people are really ruining their life, ruining their health, their liver, and they just are not able to stop. And sometimes it can be very helpful if a judge is involved. Thank you.